Hey guys, it's Anne, and welcome back to another episode of Nursing Uncharted. Today, this episode is pretty special to me. This is something that has been weighing on me for a little bit right now, and I think it deserves some attention. So, with that being said, it's focused on all the struggles that we've seen over the last few years, and all of the new nurses that are transitioning to the bedside. When I was in nursing school, things were a lot different. We had a lot more patient contact. We were able to put IVs in on actual patients. But with COVID, and even before COVID, things have changed into more simulations and not getting that direct patient care as much as I did or even nurses did prior to me. So I just kind of want to focus on maybe some tips for new nurses entering the field, and then also, how I can help these new nurses and things that we can all do to kind of help one another get into a better groove. So, new nurses out there, this is the scary time. We've just graduated nursing school. Most of the time we have jobs lined up, but sometimes we're just living the college life and the graduation sneaks up on us, and now we're out there looking for a job. It's Some people know what they want to do right out of nursing school, but like for me, I didn't know what specialty I wanted to be in, and that came, a few years later. So there are some programs out there for new nurses. There are new grad programs that I think are a huge asset to new nurses transitioning into a specialty or, med surge, telemetry, whatever you feel is best for you. And those new grad programs are designed to help you as a new nurse get comfortable providing direct patient care to patients and not your, simulation patients that you experienced in college. So I really think that new grad programs are a great way to start if you're looking for a new job. There are hospitals out there that don't have those programs. For me, I didn't have that program. I was at a small community hospital, and I thankfully had some really good mentors that took me under their wing and showed me how to do things. But I do think that's a big takeaway that I've seen, that because the hospital I'm at right now actually has a new grad program, and I see the attention to detail and just the basics that are taught and integrated into that program. So starting out, I think if you're nervous or just not really knowing what direction to head, I think that looking for a hospital that has a new grad program is a really good place to start. It's super scary to start a new job. I mean, as a travel nurse, I start a new job quite often. So, I even get butterflies when I'm going into a new hospital. So don't worry that you're scared, because it's normal and we've all been there. So, those nerves are normal, and just embrace it and just make it push you to want to get as comfortable as fast as you can. So once you're in the hospital, I do think it's a good opportunity to seek out as many new opportunities that you encounter. So that being said, if a doctor's rounding at the bedside, which bedside rounds are a huge thing right now. So when they're rounding at the bedside, listen to the doctors, listen to the residents, listen to the nurses interacting with the doctors. You're going to learn so much in just soaking in those experiences, that you will be surprised how much that can help you. You're going to learn how to associate the things they're saying with an actual patient that's experiencing that. And I think those are great opportunities. Along with that, if there's an IV that needs to be put in, if there's a Foley catheter that needs to be put in, those are the tasks that sometimes the bedside nurse doesn't really have time to do because we're busy running around doing so many other things. So you seeking out that opportunity to learn, seeking out that opportunity to put that Foley catheter in for the nurse that is drowning in her assignment, she's going to love you. And that may set you up to have that nurse even be a mentor for you in the future. So, just taking taking ownership of your knowledge, taking ownership of your career and your professional growth can really help you be successful. And it can also help you gain respect from your peers, because you walk in there and you're a go-getter, people are going to want to teach you. I do think nurses are teachers at heart. I think that we all deep down love to teach like new nurses our knowledge that we've learned of experiences that we've gotten along the way. So, just any opportunity you can make yourself known to everyone, I think that that's just going to set you up for a great, great success. With that being said, so you're learning all these new tasks. We're not able to remember everything that we experience. So I think that especially in the beginning, it's important to take notes. With me, I had like a binder where I would, write down step by step what supplies do I need to start an IV? What supplies do I need to do a blood draw? What do I need to do first to maintain a sterile field? Taking those notes and writing that down will really be helpful, because you're the one writing it down. You were the one that actually performed that task. And now when it's time for you to do that on your own, you can go back to notes that you've personally taken and perform those procedures and those tasks. There's a lot of good resources out there now. There are actually pocket guides that are already put together for you. But on my last travel assignment, it was kind of funny because my manager really wanted to have this pocket guide or like resource guide for the nurses to like keep in their pocket. And it just brought back even memories for me of early on in my nursing career. Like that's what we did. We didn't have, the quick little policy lookup on the internet. We had to kind of keep those notes ourselves, because to go through a binder to find a policy like took some time. So, even though technology is out there, I think it's still important to utilize the basics and, keep those pocket guides, keep those notes, have a resource binder, whatever fits for you. And if you're tech savvy and that's what you love, do it on your phone. There's great apps, or even just make like a notes document to keep all that stuff together. All this stuff will just prepare you later in your career. For me, when I was trained to be a transport nurse, we had an awesome protocol book, and I kick myself to this day that I don't have that protocol book. I think I paid it forward and passed it along when I left that position to a new transport nurse, and I wish I still had it, because I'm almost forgetting how to do the things I used to do, because, everything's always changing. So, if I can give you a tip, never lose those pocket guides. Even if you switch specialties, even if you think, I'm never going to use that again, just keep it. Make a bin for yourself, throw it in your attic, put it in the back of a closet, wherever. Like, it's something that I can tell you from experience, I regret not holding on to a lot of things that I have. So that is my tip out of this. And then I talked about this earlier, is like finding a preceptor. We're all assigned a preceptor. That's part of any new nurse, experienced or a new grad entering a new facility, a new unit. We all have a designated preceptor. Beyond the preceptors, there are nurses that you will get to know that can be a mentor for you. And you may not be assigned to them or, working with them every time you're there, but you'll see the people that, really want you to succeed. And that's what I want you to look out for. I want all you new nurses, newer nurses, even experienced nurses entering new specialties. Like, I'm seeing a big shift in that too, which is great. We all have to find a friend or find a buddy just to get us through that transition. And, that's where I see a little bit of lack. It's hard to say, just a little bit of lack of experienced nurses that want to help the new nurses succeed. And that is the part of this that's really been weighing on my heart, is I am now part of that group that should be mentoring and precepting and just taking new nurses to build them with the fundamentals that I was given as a new nurse. And when I think about my frustration, if I'm, getting report and something's not done right, or like, oh, why is this done this way? I have to reflect on myself too, that, hey, that's my opportunity. That's my opportunity to teach this person because they might not know. A saying that I say all the time is, you don't know what you don't know. So if you don't know it, how are you going to do it? And the only person that's going to tell you, or the only people that can tell you that you maybe didn't do something correctly or you forgot to do something, are the nurses that find it. And that's on us, and that's on me to, make nursing great, make it what it was, make it to be why we entered this in the first place. The past 5 years, I think it's been really difficult for us. Our mental health has struggled. We've been overworked for a lot of years, and now we're kind of starting to feel the repercussions of that. And we're all a little frustrated. We're all a little bitter, but we need to remember why we do what we do in the first place. And that's a big responsibility for me. So, I'm here trying to give you guys advice, but this is advice to myself. And that's why I really wanted to record this episode, because this really is weighing on me. And when I say it weighs on my heart, it does, because I want nurses, and this may sound a little conceited, but I want nurses to be like me. I want them to have the caring and the heart and like just the joy that I get out of why I chose this career. And the only way to do that is to help our young. Nurses are notorious for eating their young. And I will tell you, I was eaten alive when I started this, but that pushed me. And a lot of the nurses that did that, you circle back after you get off your orientation and they're like, aren't you glad I pushed you? Aren't you glad I pushed you? And in a way, I really was, because I didn't want to mess up. I didn't want someone to yell at me. I didn't want to be embarrassed by a doctor. And, culture fluctuates depending on what hospital you're at, and East Coast medicine versus West Coast medicine. But, I think ultimately, every nurse, every healthcare provider you work with, they want the best for you. And we just show it in different ways. Some are coddling, some are brutal. But, as a new nurse entering into that environment, you just got to understand that 99.99% of those people want the best for you. So if someone gets mad, it's not because they're mad at you. It's because they could have potentially caused harm. We're dealing with life and death situations. This isn't, oh, I forgot to submit a paper by Friday, so now I have to submit it by Monday. We can't make those mistakes. So there is a lot of pressure on us, and there are high stakes in a lot of our days at work. So the frustration, I can guarantee, is not personal most days. So it's tough. It's tough, but I want everyone listening to this, new, middle, old, to just be patient with one another and, embrace these changes and embrace one another and be there for one another, because it's tough. And I think it's going to get better. I'm hopeful. I love my job. I love what I do, and I can only look at the positive and not focus on the negative with that. So that's why this episode is really important to me. So we talked about all the new nurses, but let's talk about my generation. And, even I've been a nurse for 15 years. Yes, 15. Saying that out loud is brutal sometimes. So I'm kind of part of that older generation in nursing right now. And I'm the population that should be focusing on making it the best it can be. So we all know how it was when we transitioned to the bedside. We know what we went through. So we kind of have to take a deep breath and be patient with the rookie mistakes that happen, and they will happen. And, let's be honest, I make mistakes. We make mistakes all the time, but we just want to make sure that those mistakes aren't detrimental mistakes. So that's why we have to really be supportive of one another. Again, this has been a huge wake up call for me personally, because in the specialty that I'm in NICU. our patient population is so vulnerable, and little tiny mistakes make huge differences. So I get frustrated, but talking about this and saying this out loud to myself, it makes me really open my eyes and take a deep breath and be patient. And that's what we really have to do. I've said that multiple times during this, and I apologize, but it really is the key aspect of how to make nursing great is being patient. We deal with patients, but we also have to be patient with one another. My my nursing career would not be where it is today without the people that I have thankfully encountered during my my career, good and bad. There's a doctor that I think about to this day that I'm terrified of her, but I'm grateful that I had her because it pushed me that when it was my turn for bedside rounds, I knew my patient, I had a plan in my head, and I knew everything. And that molded me to be who I am. And it kind of I want to pay that forward. I want to be kind and a little bit softer, but in a way, fear helped me. So sometimes that can motivate you, but I'm not here saying let's go out and scare all the new nurses. I don't want to do that. I want us to be kind to one another, but we do deal with life and death situations. So if you mess up and we get a little irritated, it's just because it's life and death, and that's what we gotta remember. But when I first started out, I went to a very, very small community hospital. I was 21 when I got my first job. I mean, looking back, I'm like, how did I do this? But I showed up at the hospital, had my orientation, but I was given 6 to 8 patients. And looking back, I don't know how I did that. But at the root of that are the nurses that took me under their wing and held my hand through it all. Like I can still name them, like Angie, Rose, like just these nurses that were patient with me and helped me and, facilitated correcting my mistakes. That is something that I want to pay forward to the newer generation. When I was only at that hospital for a couple years, and then I think I told this story in my first episode introducing myself, but I volunteered for that hospital at a health fair and took a blood pressure. Long story short, ended up in the NICU. And my mentor, and I hope she listens to this, I hope you're listening to this, Kim, changed my life. I was so nervous my first day. I remember I started with a girl named Erin, and the day that we went in to meet our preceptors, I met Erin's preceptor first, and she was like so nice. She was, so welcoming. And then I went and met my preceptor, Kim, and she was in the middle of, I think it was like doing a line change. So she was sterilely hanging an IV line, and she was just like, "Oh, hi, we'll connect when you start in the unit." And I was terrified. I was like, Erin, why is your girl so nice and mine barely talked to me? Like, what am I going to do? What am I going to do? But long story short, she was the best thing that could have ever happened to me. She showed me how to be a nurse, how to be caring, how to be a good human in a lot of situations. When we're working 12-hour shifts, we basically live with our colleagues. So they become part of our family unintentionally. But I learned a lot about life, and I learned a lot about my attitude and my personality just from a job, like being oriented at a job, so when I say it changed my life, it did. These are the people that influence you during, I feel, your most vulnerable time, your 20s. That's when you kind of transition into adulthood and get your big girl pants on. And I say that because my orientation in the NICU was, I think it was 4 months. And a saying that always was said to me was, you got to put your big girl panties on. And that's true. Like there's some tough personalities in the healthcare field, nurses, doctors, whomever. It's tough personalities. You can't get your feelings hurt. I cried a lot. It's terrifying, mostly out of fear, just to, making mistakes. But, also like I got yelled at. I made mistakes. I felt bad. I didn't want to mess up. So there were a lot of tears shed. But at the very end of my orientation, she got me like a little gift bag, and it was like cute, like little toiletries. And then at the bottom of the bag, she pulled out a ginormous pair of white panties. And she said, "You did it. You finally earned your big girl panties." And I will never forget that. And everyone laughed. I mean, it was like set up. I was the only one that didn't know I was going to be gifted underwear during my shift at work. But, it goes to show the heart of Kim and what she wanted for me, and the ground and the road she paved for me. And, I can't express how much I appreciate that and how grateful I am for that. And I would love for you guys to meet Kim. I'm going to have to work a little magic to get her on here with me. But, Kim, you made me the nurse I am today. And I'm so proud of that. I always wanted to be like you one day. And I hope I made you proud too. I hope I lived up to your expectations. And, and that's in any relationship. That's what you want to do. You want to make each other proud. You want to be there for one another. And, I want to be that person to someone else. And I recently realized that I want someone to remember me and to remember what I've done for them, or just, was able to aid in their career. And, that's why I wanted to come on and have this talk and this episode, is just, shed some light on what it is worth for us experienced nurses to pave that path for these new nurses who are terrified. They may come in with a little chip on their shoulder, but this is the beginning of their life. This is the beginning of their career, and every little thing in the beginning makes a huge difference in the end. And I hope that some of you guys can relate to this. I hope some of you listening are the people that I mentioned, because I really do, from the bottom of my heart, cherish everything you've done for me. And I strive to be like every single one of you. Every day I enter the bedside. And I just hope that this is your encouragement out there to, be that person, be the best, brush off the chips, brush off, anything we're feeling with the new generation coming in and all these changes that are happening, and just support one another and create a rock solid team of nurses nationwide and worldwide, because that's what we need. This is now more than ever, is when we need strong nurses to actually care. I'm just going to end it there, to just care for one another. So I hope you take something from this, and I'm glad I was able to talk about this and share my heart with you guys. And I can't wait to hear what you guys think. Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.